Experience the miracle of a baby growing in the womb. When the man ejaculates inside the female body, up to 500 million sperm travel, but only one of them will survive the long and difficult journey to enter the egg. The sperm and egg fuse. A new life arises and the zygote is formed. This is 0 hour. 4 hours later, the zygote divides into 2 exact cells. On the 5th day, this group moves to the environment that will protect it and will see it grow for the next 40 weeks. Month 1, weeks 1. 4. During the first month, you may not be aware that you're pregnant yet, as it's calculated from the first day of your last menstrual period, LMP. Your body prepares for pregnancy by releasing an egg, which is fertilized by sperm if you have intercourse around this time. The fertilized egg implants into the uterus and begins to develop into an embryo. Month 2, weeks 5, 8. By the end of the 2nd month, the embryo develops into a fetus. The major organs and body systems start to form. You may experience symptoms like fatigue, breast tenderness, frequent urination and morning sickness, nausea and vomiting. Month 3, weeks 9, 12. The fetus continues to grow rapidly and its facial features become more defined. The risk of miscarriage decreases significantly after the 1st trimester. You might notice a reduction in morning sickness and an increase in energy level. Month 4, weeks 13, 16. The fetus's limbs become more proportionate and it can make movements, although you may not feel them yet. Your belly starts to show and you may gain some weight. You might undergo prenatal screenings such as an ultrasound or blood tests to check the baby's health and detect any potential issues. Month 5, week 17, 20. Your baby's movements become more noticeable and you may start feeling kicks. Hair begins to grow on the fetus's head. You might experience back itches, leg cramps and stretch marks as your body continues to adjust to the growing baby. Month 6, weeks 21, 24. The fetus's senses develop and it can hear sounds from outside the womb. Its lungs continue to mature, although it would still need medical support if born prematurely. You might experience more significant weight gain and possibly experience Braxton Hicks contractions, which are usually painless practice contractions. Month 7, weeks 25, 28. The fetus's eyes open and it starts to have regular sleep and wake cycles. Your belly grows larger and you may experience shortness of breath due to the growing uterus. You might be advised to start monitoring fetal movements regularly and consult your healthcare provider if you notice any significant changes. Month 8, weeks 29, 32. The fetus gains more weight and stores fat under its skin. Its organs are nearly fully developed and it has a good chance of survival if born prematurely. You might experience more frequent trips to the bathroom, heartburn and swelling in your legs and ankles. Month 9, weeks 33, 40. The fetus continues to grow and settle into a head-down position in preparation for birth. You might experience increased pelvic pressure, more Braxton Hicks contractions, and difficulty sleeping. Towards the end of the 9th month, you may experience labour and give birth to your baby.